First, tonight, the debate over Roe v. Wade continues after a leaked document shows the Supreme Court would vote to overturn it. Some states already have protections in place, but Democrats say they're working on legislation to make Roe v. Wade into federal law nationwide. But with the filibuster in place, there's little to no chance that would pass in the 50-50 Senate. Thanks for joining us tonight at 6, everybody. I'm Yolanda Harris.
And I'm Andrew Kinsey. Right now, abortion is still legal here in Ohio. So tonight, we wanted to break down the impact if it weren't.
10 TV's Brittany Bailey is looking at who's getting abortions in our state and what it would mean if abortion is banned. Brittany?
Well, Andrew and Yolanda, since the leak of that draft opinion on Roe v. Wade, we've talked a lot about how people on both sides feel. And surveys have shown the majority of Ohioans do support abortion rights. But tonight, we're digging deeper to look at the stats here in Ohio and 2 OSU studies.
Roe v. Wade has got to go. Hey, hey!
Protesting for or against abortion is nothing new in this country, but it's certainly back front and center this week.
A lot of confusion, but abortion is still legal here in Ohio right now, and Planned Parenthood stores are still open.
For how long is the real question. Ohio is one of several states where if Roe v. Wade falls, a ban on abortion is either certain or likely. So first, we wanted to find out who's getting abortions in Ohio. For that, we pulled data from the Ohio Department of Health. In general, we're talking about a non-white woman in her 20s who has never been married, and she's getting the procedure in the first 9 weeks.
So we wrote a paper saying what would happen to patients in Ohio who needed abortion care if the trigger ban passed and if Roe versus Wade were to be overturned by the Supreme Court.
That's Dr. Allison Norris with OSU and the Ohio Policy Evaluation Network. She recently worked on 2 studies showing the impact on Ohioans if abortion were to be banned.
For people who are poor, the hurdle of having a car, driving hundreds of miles, potentially an overnight stay, childcare, missing work, those can become insurmountable to people who don't have a lot of financial resources.
The study found that right now, people in all 88 counties in Ohio are within 99 miles of a clinic that provides abortions. If Ohio were to ban abortion, forcing patients to go to Michigan or perhaps Pennsylvania, they would have to travel 7 times longer on average. If abortion is then banned in those states, that number jumps to 10 times longer.
So this really does become a stark inequity where people who have money will still be able to get this very ordinary, safe health care, and people who don't have money will be denied that opportunity.
The impact would be felt mostly by those who are low income and people of color who already face greater complications in childbirth.
For folks who cannot obtain an abortion, there's a number of downstream consequences that are harmful for people's ability to live their best life. People who don't obtain an abortion that they need and want are more likely to live in poverty. They're more likely to stay with an abusive partner. They're less likely to achieve their life goals. So in so many ways, access to abortion is a really critical part of living one's best life.
Now, that second study we mentioned focused on patient travel for abortion. So right now, up to 25% of women travel out of state. This is across the country for abortions if they live in a restrictive state. The study showed that would only multiply if more states enact bans, and that would only amplify the disparities in those able to access the procedure.